I found that when I increased the quality of life for a woman, I increased their life expectancy. Now we have proof that that is the case. All 4 of the postmenopausal hormone studies in the Women's Health Initiative demonstrate that when women initiated their estrogen and progesterone before age 60, which 100% of my patients had done, there was an independent, consistent 30% decreased death rate from all causes of death compared to placebo normal women. What I'm going to share with you on this next slide is something that I got out of the data of the Women's Health Initiative. I have never seen this published anywhere else. What I determined was that when women took hormones in either the 2 clinical trials on the left or the 2 observational studies on the right, there was a 30% decreased risk of death, either in the short-term clinical trials on the left or the observational studies on the right. In the upper part of the slide, and with the pink, 100% of these women had had a previous hysterectomy, and so they just took estrogen. They did not take the synthetic progestin. If a woman had her uterus intact, she took estrogen plus progestin to protect against the estrogen-triggered cancer of the uterus. What we see clearly when you look at the slide as one unit is the placebo or non-hormone women in white have a higher death rate, a 30% higher death rate than the women taking hormones. In pink for estrogen on top, and blue for the estrogen plus progesterone in the lower 2 portions. So when you see something consistently, like you do here, a 30% consistent decreased risk of all causes of death in women with hormone use, you begin to believe that that may be valid. The Harvard Nurses Health Study confirms that when estrogen or estrogen plus progestin is started at the usual time, that is before or within 5 years of menopause, for the usual reason to reverse the menopausal symptoms, their mortality was reduced by 37%. What we're seeing in this particular slide, that the protection against death in the WHI Premarin-only participants is overshadowed by age. Initially, we're seeing a 10% decreased risk of death with Premarin users when they were 50 to 59 years of age when they start their hormones. If that was delayed and they didn't start their estrogen until 60, 69, there were an equal number of deaths in both groups. But if they waited and started their estrogen at age 70 to 79, there were 24 more deaths with the hormone users. And it's quite apparent that if we were to group all 3 decades together, the much less frequent deaths in the youngest age group is going to be dwarfed compared to the very high number of deaths seen in the much older women. Now I'd like to discuss one of the major concerns women have had in the past about taking estrogen, and that was the fear of developing breast cancer. I think you are going to be amazed at what we got from the Women's Health Initiative and subsequent studies. First of all, the Harvard Nurses Health Study. They determined that the breast cancer risk is primarily with the estrogen plus progestin, not estrogen alone. They found that breast cancer risk double within 5 to 10 years of use of estrogen progestin. Estrogen only was associated with a much smaller but statistically significant increase of breast cancer only after 20 years of use. This implies that the synthetic progestin and not estrogen may be the primary hormonal risk factor for breast cancer in postmenopausal women. Indeed, in the two WHI Premarin and Prempro clinical trials, we see opposite breast cancer risks. With Premarin alone, we see 23% decreased risk with 7 fewer breast cancers per 10,000 women per year. In contrast, in the two hormone study, the Premarin with the Probera, the synthetic progestin, we see a 24% increased risk of breast cancer, 8 more breast cancers per 10,000 women per year. And that is a study that got half the women in the world to stop their hormones, most without consulting their doctors, because of that publicity in that study, and we'll talk a little bit more about that shortly. What's important, and I've got the asterisk in this slide, that increased risk of 24% with the combination of estrogen and progesterone, it was not even statistically significant. The data was over-exaggerated and it was incomplete. You say it was incomplete data that was reported in that infamous study? Yes, it was missing the last 10 weeks of data, and I'll explain that further. It is fair to compare the two studies, the Premarin and Prempro clinical trial data, because WHI researchers indicate that both the incidence of breast cancer and something called the 5-year Gale risk factor for developing breast cancer were the same in the two hormonal studies. These strongly suggest a role for progestins for increasing the risk of breast cancer. This is one of the most important slides I'll show you, because everybody was under the medical research's emphasis for 50 years that estrogen would cause breast cancer. This study completely eliminates that as a possibility. What happened here, you heard about the two hormone study, and we'll go into that in the near future. But in the estrogen-only study, we saw we broke the women down that participate in this study into 4 different groups. One group never took estrogen in the past, and they took the placebo in this study. So these women were never estrogen users. And you can see in the white dotted line, they had the highest risk of breast cancer of any of the 4 groups of women we're talking about. The other 3 groups of women all took estrogen. One didn't take it in the past, but did take it in the study. The second user did not take it in the past, but did take it in the study. And the final took it both in the past and in the study. And once again, all 3 groups of women who took estrogen either in the past or in the study or both, they all had a lower risk of breast cancer than the never estrogen users. In addition, Dr. Anderson, who had to go to England to publish her article in 2012, she demonstrated that in the postmenopausal women who used Premarin for an average of 6 years and then were followed for a total of 12 years, they had a statistically significant 23% decreased risk of breast cancer. There were 151 cases of breast cancer with estrogen compared to 199 cases of breast cancer in the placebo group. But something I've never heard anybody discuss is her second point, which demonstrated a statistically significant 63% death rate from breast cancer in women with previous Premarin use. That is completely contrary to what Western medicine told us for 50 years. Invasive breast cancer and estrogen plus progestin use in the WHI PremPro complete data version. When the last 10 weeks of data were added and the data was now complete and published, they demonstrated that the 24% increased risk of invasive breast cancer with both hormones, Premarin and Provera, was now statistically significant. There was no increased risk in breast cancer in the first 5 years. It doubled the risk years 6 through 10, and the risk with the two hormones tripled with more than 10 years of use. This is in complete agreement with the previously published data from the Harvard Nurses study. In this slide, we see the short-term and long-term risk of breast cancer in the 4 WHI postmenopausal hormone studies. In the estrogen only, in the light pink, the short-term, there were 7 fewer breast cancers. Whereas on the right, in the estrogen plus progesterone group, there were 8 more. When we look at the long-term risk of breast cancer, with the estrogen only, there were 4 more, a minimal risk, compared to the 2 hormones, estrogen plus progesterone long-term, there were 40 more. That is 10 times as many breast cancers with a combination of the 2 hormones in the long-term use. In this next slide, the British Million Women study, I want to make a point. I want you to focus, if you would, on the right-hand side, which talks of cancer of the uterus. In the 1970s, 3 studies came out that demonstrated that when women took estrogen by itself, there was an increased risk of breast cancer. And this is demonstrated on the right in pink, estrogen alone. You can see that slightly higher than the white who were the non-users. The point they made was in order to reduce that risk, they gave the synthetic progestin, and you can see they markedly reduced that risk of cancer of the uterus. But what they didn't do in those studies is look at other consequences of adding the progestin. And in the British Million Women studies, on the left side, we see breast cancer. And we see for that minimum benefit for cancer of the uterus, we allowed 30 more breast cancers per year. We have to put things into context, and that's what's been lacking. This slide here, I'm going to give you great hope. I told you I only do bioidentical hormones. I never gave a single woman Provera, the hormone that was studied in that WHI study that got half the women in the world to stop. I only used the natural progesterone. And we have the French teachers study of 80,000 postmenopausal women, age 40 to 60. And what they did is they compared the breast cancer risk with estrogen alone in pink on the right, estrogen plus the natural progesterone in the center in the middle, and the estrogen with the synthetic in light blue on the left side of the slide. And it's very obvious that the lowest risk of breast cancer, which is 1.0 at the bottom line, is the estrogen with the natural progesterone, the risk of breast cancer is much less than estrogen low. So in retrospect, I can look back at 37 years of not giving that progesterone and be thankful to the French for doing this study that gives us a very safe, logical alternative to the synthetic progesterone, and that would be the natural progesterone.